My talk will be about the bone block in combination with ASA. 3 years ago, I published with Marco Maiotti the preliminary results of all arthroscopic procedure combining free glenoid bone graft, Bankart repair, and subscapularis upper third stenodesis, treating recurrent anterior instability with critical glenoid bone loss. Actually, we define this technique as arthroscopic bony Bankart subscapularis stabilization. Since 2016, we treated patients with this technique. At the moment, I operated 94 patients. And the purpose of this presentation is to show you the results of 65 patients with a minimum follow-up of 2 years. In all patients, we found before analysis of the defect at the Bankart, essential Bankart lesion, a capsular insufficiency and elongation, an hypermobility in RE1 position with laxity, and subscapularis elongation. In our experience of treating with these patients, we noticed that the laxity is not exclusive of the capsule, but also the subscapularis tendon. How this technique works? Our hypothesis is that the anterior isolated graft of 2 cm by 9 and 9 recreate a best inferior fit circle also for defect superior to 25%. The Bankart repair, shifting up and medially the inferior ligament, it would create a favorable anatomical condition covering the graft, and the capsule can heal with a wider footprint, as we can see in CT scan after 5 years of follow-up. And the upper third subscapularis stenodesis shifting up the tendon and muscle junction can create a sling and suspensory effect. Our material methods, 63 males and 2 females, 30.8 years of average age. The glenoid bone loss was about 16%. The laxity was present in 57 patients, and 26 were contact sportsmen. All patients were studied with preoperative plain radiographs, MRI with intraarticular gadolinium contrast, and CT scan according with the PICO method. All patients were studied with WOSI, ROW, Quick Dash, and VAS score. The surgical technique, all patients were treated in lateral position. In 9 patients, we used a free frozen graft from iliac crest. In 56 patients, we used a pre-contoured equine graft. The surgical technique was according to Taverna technique. Is important in both using pre-contoured equine or frozen iliac crest, that the graft is flush with the glenoid, and the 4 buttons can stabilize the graft on the glenoid defect. In all cases, we performed a traction test. That is important to observe the possibility and the laxity of the subscapularis tendon. And here we can see as the shift of the capsule with the inferior glenohumeral ligament can cover the graft that is extra-articular, and the Bankart repair was performed in all patients using a knotless anchor. And here we can see from posterior view the upper T subscapularis glenoid tenodesis, and in right picture from the superior portal. We have no perioperative or postoperative complications, no fracture, no nerve damage, no vascular complication, and no sepsis. And the functional results, on 65 patients, we noticed the average loss of extra rotation in here one position of 10 degrees, and in extra rotation 5 degrees. Using a iliac crest, we observed 1 on 9 ready dislocation, that is the 11.1%, and using a xenograph 2 on 56, 3.2%. We studied all patients on time, the day after the operation and until 5 years. And when we used the allograft, we observed a complete reabsorption on 7 on 9 patients, and only 1 case of resorption using the xenograft. In this slide, you can see we follow the patient, the better patients with a good using a PICO method with a good redefinition of basic inferior circle, but with resorption of 70% of the bone. Here we can see another case using an heterologous graft the day after, studied with the CT scan, at 2 years of follow-up, at 4 years of follow-up. We have no fracture of the xenograft, 1.7% of resorption, no displacement of the graft after from 2 to 4 years, no signs of glenoid tunnels loosening, and 2 asymptomatic secondary osteoarthritis according to Samison-Prieto classification. Here we can see a patient studied with MRI, TC scan, and the clinical result. And here we can see the statistical analysis of a clinical result using the scores according to WOSI, ROVE, Quick Dash, WOS, and we observe a good p-value, especially in WOSI evaluation. And here we can see a contact sportman. And this technique can be considered a very safe technique because we have no perioperative complications, no postoperative complication with excellent clinical results, no signs of increasing osteoarthritis with low recurrences. We have some limitations of this study because it's a short list of patients treated with a short follow-up time. And due to the relative novelty of the described technique, there are currently no peer-reviewed studies specifically reporting on similar experience using a xenograph as bone augment. And there are no control group of patients. Thank you very much.